A defective immune system response causes type 1 diabetes. The role of the immune system is to protect the body against any external agents that may threaten its health. For some people, the immune system attacks their own cells, which it wrongfully perceives as a threat. In the case of type 1 diabetes, the beta cells of the pancreas are destroyed as the result of a faulty immune system response. The decline in beta cells is estimated to occur over a 5 to 10 year period or longer in some cases. Hyperglycemia occurs when 10 to 20% of functioning beta cells remain. Complete destruction of the beta cells leads to total insulin deficiency. Several hypotheses are being explored by researchers to explain this immune system disorder. Genetic factors have been identified. Environmental factors, such as certain viruses or chemicals, are suspected. However, to date, no studies have been able to confirm these hypotheses. Genetic predisposition seems to play an important role in the development of type 2 diabetes. The presence of risk factors associated with certain behaviors or the person's environment are involved in insulin deficiency and the cell resistance to the action of insulin. The process leading up to the development of type 2 diabetes likely began several years before diagnosis. At least 50% of beta cells are destroyed at the time of diagnosis when hyperglycemia is detectable. This process likely began in the 12 years prior to diagnosis. We have just seen that a combination of factors related to genetics, certain behaviors, and the environment increase the risk of developing type 2 diabetes. Some risk factors are modifiable while others cannot be changed. The following factors are non-modifiable risk factors for type 2 diabetes: being of 40 years of age or older, having a first-degree relative with type 2 diabetes, either a mother, father, brother, or sister, being a member of a high-risk population, taking certain medications, and for women, having developed diabetes during pregnancy, also called gestational diabetes, or having given birth to a child weighing more than 4 kilograms or 9 pounds. The following risk factors are those that can be changed: having pre-diabetes, excess weight, a larger waistline, smoking, high blood pressure, and complications with diseases associated with diabetes such as polycystic ovarian syndrome, cystic fibrosis, and pancreatitis. In many cases, it is the presence of several of these risk factors that triggers the onset of type 2 diabetes. However, this is not inevitable since many of these factors can be counteracted to reduce the risk. Why not discuss this with a healthcare professional? This course has been made possible with the financial support of Roche Diabetes Care, a division of Hoffmann-La Roche Limited.